Hello everyone, my name is Aditya and I'm one of the doctors working at Queen Alexandra Hospital situated in Portsmouth, and I'm here to present my poster which is based on an audit on bone health assessment in the Department of Internal Medicine at Queen Alexandra Hospital. This audit has been conducted by my colleague Dr. Joy Balaji and myself under the supervision of our consultant Dr. Georgios Aparis. Our abstract ID is 1636. Osteoporosis, as we all know, is one of the major contributing factors towards poor bone health, especially in elderly patients. It affects roughly 1 in 2 women and roughly 1 in 5 males. You'll be shocked to know that there are over 500,000 fragility fractures each year. The risk factors for osteoporosis basically include chronic steroid use, low BMI, especially lesser than 18.5, a previous fragility fracture, old age, smoking, and chronic alcohol use as well. Now, fragility fractures are basically fractures caused because of a low impact injury. For example, if we have a 25-year-old male and if he trips and has a fall, there is a much lesser chance that he will have a fracture as compared to a male who's 75 years of age and has osteoporosis. The aims and objectives of our audit was to see the proportion of patients who had their bone health assessment done in our department, thus checking our compliance with NICE guidelines. The NICE guidelines for bone health assessment states that all males of the age 75 and above and all females of the age 65 and above should have their bone health assessment done. We held one audit cycle, which basically comprised of an audit and a re-audit. This was done in the year 2022 in the months of October and November respectively. Our sample size was 45 patients each. Data was collected from the patient's case notes, electronic documents, previous clinical documents, and a few details from the patients as well. We used a questionnaire which basically involved the patient details, risk factors which I stated before, whether or not bone health assessment was done, and if it had been done, were they treated appropriately or not. After doing the first audit, we found out that only 29 out of 45 patients had their bone health assessment done, making it only 64% of the total sample size. We implemented certain changes, such as we held a teaching session in the department where we spoke about bone health assessment, how to do the assessment, the significance of osteoporosis, how to treat patients for osteoporosis after doing the bone health assessment. After implementing these changes, we did a re-audit in the month of November. After doing that, we analyzed the data once again and found that 41 out of 45 patients had their BHA done, which makes it roughly 91% of the total sample size. On comparing both the audits, we found that there was a 26% significant rise from the first audit. And this was very reassuring for us, and we were very happy with the results. To conclude, we see a lot of patients coming to the hospital after having a fall, sustaining a fragility fracture, hence making bone health assessment an absolute imperative in our opinion. This not only helps reduce the risk of fragility fractures, but also improves the quality of life. Thus, I would encourage all to kindly incorporate bone health assessment in their daily practice, thus improving patient care and safety. If you have any questions, please feel free to ask us and drop us a comment in the comment section. The references that we used were basically the NICE guidelines and the FRAX calculation tool on the FRAX Sheffield website. Thank you for attending this, and I hope this was beneficial to you. Thank you so much.